Hey everyone, this is Ashley with Evans Behavioral Services. Today we are talking about red flags to be aware of in ABA providers. So if you are looking for a provider for your child, or you are pursuing a job in the ABA field and looking for providers to work for, these are 7 red flags that I feel you should, steer clear of when you see these in ABA providers. For those of you who are familiar with me, I am a BCBA and I have worked in the ABA field for almost 14 years. So I do have a good bit of experience, and unfortunately can say that I have personally done some of these red flags practices years ago. But thankfully, our field is really progressing and moving away from some of these. Unfortunately, we are still seeing many providers who are kind of stuck in the old days. So these are the red flags that I think you as a parent or as a potential employee should really be aware of. First one, focus on reducing harmless self-stimulatory behavior. So the keyword there is harmless. So stimming, short for self-stimulatory behavior, those are, actions that we do, everyone does, even neurotypical people, that just feel good. So, I have this stim where I like shake my leg, it's like a self-soothing thing. I do it without even thinking about it. I don't have anybody, because I am neurotypical, I don't have anybody coming in saying, you need to stop doing this. I feel that the focus on reducing self-stimulatory behavior is very ableist in nature, because we don't, like I mentioned, we don't go telling neurotypicals that they need to change the way that to reduce those self-stimulatory behaviors. We acknowledge or accept those very willingly. But if somebody has an autism diagnosis, because self-stimulatory behavior is part of the symptoms of autism, it seems that that's kind of where professionals feel like, oh, that must need to be reduced. So a focus on reducing those self-stimulatory behaviors that are not harmful is a red flag for me. Number 2, focus on sustained eye contact. So in ABA therapy, your child will have goals that the providers work on. So skill goals, so increasing skills, and behavior goals like reducing behaviors and increasing adaptive behaviors. One of the symptoms, of course, of autism is that reduced eye contact. So again, it kind of seems to go back to, because it's a symptom of autism, that must mean that we have to work on it. I strongly disagree with this. I do not believe that there's much reason at all to work on eye contact, and definitely not sustained eye contact. So there are many autistic adults out there who have communicated that sustained eye contact, or even just making eye contact, is very uncomfortable, if not painful. Why would we need to do that? If we know that they're reporting that this is causing pain, let's acknowledge and respect and honor that, and skip that goal. There are other ways that we can work on attending, like orienting your body toward a speaker, things like that are not going to cause harm. So again, focus on a sustained eye contact is not a necessary goal. I would consider that as a red flag. Number 3, aiming to recover or cure autistic people. This one is just, what to even say about this? I feel as though there is no need to recover or cure an autistic person. An autistic person is not in need of a cure. They're in need of support to help them work on some, skill deficits, reduce challenging behaviors so that they can better interact with others and, live a fulfilled life. But they're not in need of recovering by any means. I only just heard that word recently as related to autistic people, and was really appalled. Couldn't believe that anybody thought that autistic people were somehow in need of a cure or recovery. So if you're seeing advertisements that an ABA provider is going to cure your child or recover them from something, definite red flag. 4, forced compliance. This is painfully slowly changing. In the ABA world, there's always been this belief that all demands need to be followed through on. If you give your child or the client, the learner, a demand, you must follow through on it at all costs. And to the point that the kiddo might be having a tantrum for an hour and you stick through that and follow through to the end. This is very detrimental. We now know that we need to be acknowledging our learners' assent and assent withdrawal. So if they are withdrawing their assent, we should not be forcing that compliance. Of course, there are going to be times when your kiddo is running into a street and you tell them to stop. You got to run toward them and stop them. If it's for safety, yes, by all means, follow through on that compliance. The other thing with forced compliance is not allowing a child to escape an aversive situation. So not allowing them to demand for a break or to request modifications in the environment, to request for help, things like that. Those are all red flags within the forced compliance umbrella. Number 5, high recommended hours for all clients. I think this is starting to change more and more, especially with funding sources, kind of looking at treatment plans and thinking, does this child really need 30 or 40 hours a week of therapy? But there are still providers who are motivated to get in as many clients with as many hours as they possibly can. If your child is being recommended for a high number of hours and you don't really see that as matching their need, definitely ask questions. I would consider that a red flag to at least ask some questions and try and delve a little bit deeper into that. Number 6, using food as a reinforcer. This one I consider a little bit of like a yellow flag, just because it's a very hotly debated topic. It's pretty controversial. Many people in the ABA field will still use edibles as reinforcement, and therefore I struggle to entirely say that it's a red flag. But I really do think that with food being a primary reinforcer, we should not be using that to motivate people. Food should be provided non-contingently. I think that it can really open up some a dangerous cycle into eating unhealthy eating habits and not understanding that you have to sometimes earn food, other times you get it with a meal, things like that. So I think that can just open up a can of worms, and I would steer clear as much as possible. At least ask ABA providers what their view is on using food as a reinforcer. If it's, oh yeah, we definitely do that, I would consider that a red flag. If it's if that's the only reinforcer that we found for a child will use it, I wouldn't quite consider that a red flag. So like I said, just at least delve into that a little bit more and ask some questions. And number 7, refusal to collaborate with other providers. Unfortunately, some ABA professionals feel that ABA is all a child needs, that with 30 or 40 hours a week, you don't even have time for speech or OT or any other therapies. And they'll tend to fall back on, well, those therapies aren't evidence-based. And I strongly feel that we all have our strengths, and ABA has great potential to do wonderful things for many children. But that doesn't make us the only provider for children with autism. That doesn't mean that we are the only one that can help them with communication and behavior reduction and things like that. Like, there are other therapies that can definitely make progress and help your child. So if a provider is saying, no, I'm not going to collaborate, I don't think you should explore speech for your child, anything like that, I would suggest that you steer clear. I think we need to humble ourselves and understand that we only know what we know, and other providers are going to have their experience and expertise that they can provide as well. And I think as long as it's not going against like significantly what we are trying to do, where it would, cause the two to clash, I think that it's wonderful to reach out and find as many resources as we can. So I do go into all of these a little bit further in depth in an article on my website. Feel free to check that out on evansbehavioralservices.com. Thank you so much for listening here. I also want to just say that I understand and acknowledge there are many people who have just a general negative view of ABA. Many people who are autistic and had experienced, that negative treatment firsthand. So I understand, I respect their opinions, their feelings on ABA. My hope is that just through this genuine discussion, self-reflection, modification of our practices, that one day we can change that view of ABA. But that really is on us as ABA professionals to make those changes. But all right, let me know what you think. Feel free to head on over to my websites, check out other resources, as well as the full article on this topic. All right, you guys have a great rest of your week. Thanks.